Hey, it's Dr. LaHood with Advanced Chiropractic and Wellness Center. I want to share with you what a normal x-ray should look like. This is an x-ray of the lower back where there's no vertebral subluxations. The margins of the vertebrae are smooth and regular, and the joint surface is not roughened. It's evenly spaced. The spine exhibits a normal lordotic curve. The disc spaces are healthy, and there's no tissue damage at this point. Usually from a traumatic incident, a patient suffers what we call a subluxation. When it remains uncorrected, the vertebral subluxation here, you can see there's disc stress that's evident. Nerve pressure results in the rupture of the nerve roots. There's toxic production that's absorbed into the surrounding tissue, and nerve function gets hampered at this point. There's minimal soft tissue in a phase 1, but there's a loss of the normal lordotic curve. If a phase 1 vertebral subluxation is left uncorrected, it progresses to what we call a phase 2, where a phase 2, the vertebral subluxation increases in severity. The vertebral margins become rough and irregular and roughened. The joint surface is rough and irregular. There's abnormal calcium production and bone spurs are evident here. Disc space shows signs of narrowing, degeneration and decay, dehydration. So normal nerve function here is hampered. Normal nerve transmission is not possible. A phase 2 vertebral subluxation that's left uncorrected progresses to phase 3, where we start to see the very beginnings of bone fusion start to occur. There's advanced arthritic spur formation here. There's abnormal calcium production around the joint. The soft tissue decay becomes much more evident. The vertebral deformity has now started. Disc function is lost and discs are degenerative. There's poor nerve function. There's hampered neurologic transmission. The nerve is seriously impaired. So nerve failure begins in phase 3. You can see muscle atrophy and wasting in the pelvic muscles and the lower limbs based on the exam findings. A phase 3 spinal degeneration that's left uncorrected always will progress to a phase 4. Where the vertebrae has lost most of its normal form and lost most of its function. Spine fusion is complete in phase 4, but the spine form is destroyed. The discs are completely degenerative. There's calcification of most of the spinal ligaments. So nerve system failure is evident here. Nerve transmission is lost. There's bone deformation. This is a terminal condition. So once a patient progresses to a phase 4, there's just palliative relief care. There's no correction possible. If you're suffering with any spinal misalignment, neck or back pain, give our clinic a call for an evaluation.